Konnichiwa, and welcome to our 6th webinar in the Parkinson's Foundation's 10th Expert Briefing Series. The topic for today and title is When Care Comes to You, Tips for Using Home Health Aides, Physical Therapists, and Occupational Therapists. I broke into a little bit of Japanese because I've just come back from World Parkinson Congress. For those of you who were able to attend, it was a really wonderful meeting, and can look forward to information about that by going to the World Parkinson Congress website or even to our own website about what we were doing there. I'm your host today. I'm Dr. James Beck, the Chief Scientific Officer at the Parkinson's Foundation, and I'm happy to bring our expert briefing to you today. And this topic, like all the topics we have, were generated by the community. And so really pleased to be able to have today's speaker talking about something that's so important to people with Parkinson's. And we also rely, in addition to community members, an alliance of independent regional Parkinson's organizations called AIRPO that help us generate the topics for today. So for those of you who are interested in keeping a copy of the presentation today, there's a PowerPoint slide deck that can be downloaded. It comes as a PDF, but if you look on the left of your screen, there's a little blue box that says download slides here. So you click on that and you can download slides anytime during this webinar. If you're a health professional, and I know that there's a number of you who are listening in, you can earn 1 free CEU through the American Society on Aging. So if you registered as a health professional and indicated you wanted a CEU, important things, you'll receive an email by the end of the day today with steps on how to collect that credit. But remember, you only have just 30 days. That's until July 11th to collect your CEU. So keep an eye out for that email and do what's necessary to do that. And when I talk about the number of folks here who are listening in, we have over 1,600 people who are registered. And by and large, the majority of people are people with Parkinson's or their care partners. We have 550 so people with Parkinson's and nearly an equal number of care partners as well. So it's my pleasure today to welcome our guest speaker. Dr. Julie Hirschberg is a physical therapist at the USC Division of Biokinesiology and Physical Therapy. She's a neurologic physical therapist in actuality specializes in movement disorders. She's an instructor at the University of Southern California and is founder of the re+active Physical Therapy and Wellness Program, Neurological Physical Therapy and Wellness and Research Center that's located in Los Angeles. Julie, welcome to our expert briefing series.
Thank you, Jim. Thanks so much for having me and for that introduction. I am so excited to join you all today for a topic that I am very passionate about, and that is gathering a team around you in the home to live well with Parkinson's. And I'm very excited that many people with Parkinson's and their caregivers are joining us because this is going to be a very practical talk, and I think a lot of good questions are going to come up. I'm looking forward to hearing them from you. So I have no financial disclosures. I do need to say that I am a physical therapist, and I'm super passionate about that and movement disorders and Parkinson's in particular. I do run a PT and wellness center where over half of our clients are people with Parkinson's. And I teach the future PTs of the world about Parkinson's at USC. So you might hear me just get really excited and passionate about that. And biased about therapy and exercise is key ingredients in your Parkinson's journey. So today we will talk about these different roles of different people that you may use as part of your team. And first we're going to discuss what the roles of home health aides, physical therapists, occupational therapists are, and actually I'm going to throw in personal training because a lot of people ask me about trainers. They're already working with them in their homes and they have questions in particular about Parkinson's. We will, of course, talk about the benefits and the type of questions to ask. This is probably the biggest question I get asked about bringing people into the home are the questions to ask those people so that you can find somebody that's a very good fit for you. Okay, so let's talk about when care comes to you and what that means. So the first question I think about is where that is. And I like to think of where it's wherever you are and you need to be, which really might include Kyoto, Japan, if you just went to World Parkinson's Congress. And we're specifically talking a little bit about the home today, but I think that care coming to you can be many things. It can be me coming to the gym to work on getting on and off different pieces of equipment. It could be at the park because that's where you want to be with your grandkids, at the beach, at the mall. Probably one of my favorite places that I've worked with somebody is in Dodger Stadium. And I'm sure all of you who've been to a baseball game can attest to the difficulty of maneuvering in tight seats with a lot of people, getting up and down to do the wave. So all of those things can become really important. And having an expert with you in different locations can be very, very helpful. Now, there are different ways of how this can happen. It can be in-person visits. I think that's what most people think of. It can be telehealth, and this is a widely growing field. We'll talk very briefly about it in the next slide. Phone calls. So this is good old-fashioned phone calls. It's actually been a part of some of the large studies that we'll talk about later. And it can be very effective as a way to check in and be accountable to doing some exercise and some movement in the home. And finally, another growing area is wearable sensors. And this may seem like maybe a little weird of care coming to you through a sensor, but in my practice and in a lot of the research, this is used quite a bit. Having a sensor set up, and you think about it even as simple as your iPhone or a Fitbit or your Apple Watch, having that set up to track your movement, set goals, and then get feedback is a way to send care home to you. And I think a very cool way. So this is the wave of the future and something that I'm sure a lot of you are already doing. And then finally, the why. And why might you have care come to you? And probably the first reason that most people think of is because they've recently been sick or hospitalized, they're having a really hard time leaving the house, or because they're like me and they live in Los Angeles and it takes them an hour to drive a couple of hours, and that travel burden is very heavy. And these are all very excellent reasons for sure, but they're more than just the convenience. It's especially in Parkinson's, it's really wonderful to have someone evaluate and have you practice in your environment, wherever that may be. So some great reasons to have the care come to you. Now let's talk a little bit about logistics. And here I'm going to give you some of my own disclaimers because I am not an insurance expert or a Medicare expert or a telehealth expert at all. I have collaborated with a lot of colleagues in some research studies in these realms, but I'm not coming to give a Medicare talk for you all, and I'm giving you some resources here first. So I have a great link on this particular slide for Medicare for home health services. So I'll talk very briefly on it, but that link is excellent for laying out the qualifications and how you might actually get services covered. Okay, so let's back up to the top with the telehealth. So telehealth is a visit done with your provider, but you're at home and they're at their facility, and this can be done via computer or tablet or even your phone. And there have actually been some really great large telehealth studies in many neurologic disorders, including Parkinson's. And they show that people can get very good care and that they can have great access to experts, which I think is very important in movement disorders. One thing the research has shown, and this probably isn't a surprise, is that they might not like it as much as being there in person, although they do like the convenience of it. But people do like to see people's faces and to shake their hands and things like that, which you just can't get in telehealth. So this is an emerging area. It is sure to explode in the next few years. So I would say stay tuned. One of the reasons it hasn't quite exploded yet is because of insurance coverage. So by and large, it's not covered by Medicare. And private insurances vary, but mostly are not covering it at the moment. So if you have questions about that, do contact your private insurance about it. And there are some really great programs starting now. There's a great program in New York with telehealth for Parkinson's, and I think it's just going to continue to grow. So keep your eye out for that. Now let's talk about Medicare. And I put this in here because I have looked into this for a lot of my own clients. People ask me about this all the time. And one thing that I do know about Medicare is they have very specific requirements for qualifying to use your home health benefits. And this includes something that they call being homebound. And again, if you follow this link, they'll actually define it for you. But essentially, it's meaning that it's very difficult for you to get out of home or that you require help to do so. They also have this requirement of an intermittent need for skilled care. And I've had some clients denied home health with Parkinson's because there wasn't an intermittent need. They had an ongoing need. So intermittent need usually occurs after a hospitalization, for example. And so that is when most people are getting home health services through Medicare. And the services do need to be provided by a certified agency. And again, more on that if you follow that link. That's probably the most important link in these slides if you have questions. Now, also interesting, and most people do not realize this, so this last bullet point I wanted to tell you about, you can get outpatient therapy, which is typically Medicare Part B services, in your home. So if you, for example, lived in an area, you had an outpatient clinic, what I would recommend is asking about whether they provide any services in the home. Not home health services, because those are actually covered under a different part of Medicare, but outpatient services in the home. I have many colleagues that provide this type of service. We actually provide it outside of our outpatient clinic as well, and it would be something to ask for. So those are the logistics from the insurance perspective, from these emerging technologies to help pay for and get access to care coming to you in the home. And when we dive into the care and what that can be, what I want to talk about is this optimal plan, and you, your care team, your family, your social networks really being at the center of that. That's all those little people in the center. And you'll see this is a huge team. It includes speech therapy, physicians, maybe a naturopath, nutrition, psychology, social work, fitness providers. We are really only talking about today this right half. And that is the PT, OT, home health, and fitness side of things. So it's not that the other parts aren't important, but this is, we would be here all day to talk about the whole team. So we're really just going to hit on these key pieces today. And I would like to start with occupational therapy, because when I think of care coming to you, this is the first thing that I think about. And I want to start with a definition because people can get confused about what occupational therapy is. I've had people ask me, oh, does that mean I'm going back to work, like my occupation, I'm retired, I don't need it? And no, that's not it at all. And as you read in this definition, OT helps people do the things they want and need to do through the therapeutic use of daily activities. These are those occupations. And OTs enable people of all ages to live life to its fullest by helping them promote health and prevent, or live better with, injury, illness, or disability. So after you see that definition, and as I read it again, and as I've worked with many OTs, I pretty much say everybody with Parkinson's needs OT. We all need to engage with somebody who can help us promote our health and prevent or live better with our diagnosis. So I've put some things here, but honestly, like, this is my bias. I think everybody would benefit from an evaluation with OT. So why OT, in particular for people with Parkinson's? So if you're experiencing some difficulties, in particular with personal care, maybe it's caring for others like your grandkids or your kids, indoor and outdoor mobility, with your work, with hobbies, social activities, daily activities, all of those things fall in that realm of OT. And then also early evaluation. So highly recommend when you're newly diagnosed, early evaluation for prevention and maintaining your lifestyle. And I want to refer you to a couple of really awesome webinars already available from the Parkinson's Foundation by amazing OTs in this field. And one was from last year, one from 2014, both really excellent resources for you. But as we talk about what OT looks like for people with Parkinson's, what I really wanted to highlight is what this looks like with the care coming to you. And some of those important areas include excellent ability to assess the environment and make recommendations. Look at your ADLs and IADLs in the home, your fine motor tasks in the home, cognition and attention in the home. And this is especially important with things like freezing. Helping you to self-manage, so manage your daily routine, your medications, etc., in the home or in your workplace. Addressing stress, anxiety, energy, and fatigue. I mean, who doesn't need this, right? So, so many areas that OT can be of benefit for you in the home. And I wanted to add, what you'll see in the wording on the side, the lifestyle redesign. This is a trademark program of the University of Southern California Occupational Therapy program. So you'll actually only see this exact term in their practice. But the idea is very important, I think, when we think about care coming to you. So the process of acquiring health-promoting habits and routines in your daily life is so necessary in your home environment, your work environment, your social environment. So when we talk about, in the next slide here, these questions that you might ask an OT, this might be one of them. Have they had experience in these lifestyle redesign applications, if this is something that is interesting for you to pursue in the home or your workplace or in your environment? I think this is an obvious question, but do you have experience with Parkinson's, and how much experience do you have, and what types of things do you do with people with Parkinson's? Don't be afraid to ask those questions of your providers. I have found that many people end up bouncing around from provider to provider, not really feeling like it's a good fit. And so I think it's really important to interview, even over the phone when they're taking your question, when they're taking your information to set up an appointment, ask these questions and find that right person for you. I encourage people to ask questions about specialized training. Now, there are loads of different programs, and some of this is just going to come from their experience. So asking those experience questions is very important. One particular program that you may have heard about, there are a couple, another is in another slide as well, that are Parkinson specific. And by the way, I'm not affiliated with any of these programs. I don't teach for them or anything like that. The Parkinson's Wellness Recovery, or POWER training. This is one that has become very popular. It's an evidence-based program, and it is a great non-profit program as well, based out of Arizona, and many people have done their trainings. So it's not a requirement, but these would be the types of things that you can ask about. One area that OTs do specialize in is driving training. And this might be of particular interest to you if you have a concern about that. So asking about that specific background. And another is if you're having trouble with your vision and you want to address that, you can consider asking about a low vision certification. So these are all different areas where OTs can specialize in their training. And then finally, especially if you're looking for them to come to your home and make specific recommendations, do you have experience with this home evaluation and recommending modifications? I have worked with several OTs who actually have a business where they work with a contractor, et cetera, to set up home modifications. And that might be a really great resource for you, and I think a great area of expertise for OTs. And OTs also may be training your home health aides, as might PTs, so that will come up as well. So let's talk a little bit about home health aides. And I wanted to start with a definition again, because the term home health aide is very specific. This is important because they're not necessarily a caregiver or trainer or a personal assistant. A home health aide is actually a trained and certified position. In California, they're certified by the state, and they can only take courses that are certified by the state. So that's really important. And these are the only people who can provide assistance through Medicare. Now, again, I'm not a Medicare guru at all, but what I do know is that Medicare has guidelines and rules, and the same apply for home health assistance, that whether somebody qualifies for that is very, very specific. So they need to be homebound. They need to require assistance for personal care, which Medicare defines as bathing and dressing and eating, things like that. So very specific requirements of a home health aide. But if we talk a little more broadly about caregivers and personal assistants, I think this is something that a lot of people use. These are not part of the home health care need from Medicare, so typically people are paying out of pocket for this. And this is something that's widely used and a great resource for support for people and implementing a rehab plan. So I work with home health aides, with caregivers all of the time, and I think it's a huge part of our team. And the questions you ask here can be very, very important. So finding that right home health aide, and I think you would use these for caregivers as well. So I love to encourage people to ask questions very specific to their needs. So tell me about the types of things you have done to help somebody with phrasing. What if they get stuck in the chair? What types of things do you do? What types of things do you do to help them get out of bed? I have had several caregivers come in and demonstrate that within our session in physical therapy, so that I can see what they do and how they do it, and see their approach and see if it would be a good fit for the person with Parkinson's. A very important question, if it's applicable, this is not for everybody with Parkinson's, but do they have experience with dementia? So if you're trying to find a caregiver for your spouse or your family member and they have Parkinson's and dementia, having that experienced caregiver who understands dementia, understands how they might give cues and sequence tasks for people with dementia is very important. What types of techniques do you use if someone is moving slowly? So this is a question that came up as I was talking to a few of my own clients, because they were getting frustrated that they got really hurried along by a caregiver, and it tends to ramp up their anxiety and cause them to move even more slowly. And so this was something that they started asking of caregivers. What do you do when somebody's moving slowly? What's your approach to that? Do you end up making them more anxious or not? So I thought that was a really insightful question. Other questions to ask here, what types of assistance have you provided before? Have they helped out with exercise routines? That can be so helpful if they've had that experience. What about walking, heading out around the block? Do they know how to help someone and guard someone to prevent a fall? All very important from a safety standpoint. And then maybe my favorite one, again, my bias, but have you worked with a PT or OT before? And how open are you to that feedback? I've worked with thousands of caregivers in my practice, and various degrees of people being open to the feedback and the training from the PT or the OT. So if you want that nice team collaboration, you want somebody that's pretty open to training with the other parts of the team. And so this is my biggest advice for if you're in a PT or OT appointment, have that home health aide, have that caregiver in the session and actually practicing, not just observing, but actually doing the exercises that they're going to take home by actually helping them off of the floor. All of those things that the PT and OT will do so nicely, have them do it with them. Okay, I said I would throw in just briefly personal trainers. Some people really have come to me with questions about this. Personal trainers design safe exercise programs for people and help them implement those programs. And for people with Parkinson's, I think this is a really nice way to stay accountable. And a lot of people already work with personal trainers. And again, I think asking important background questions. What's your background in training? Do they have a degree in kinesiology, exercise science? Have they gotten certified? And shooting down to the question below, there's a newer certification from the American College of Sports Medicine that's called a Certified Inclusive Fitness Trainer, or CIFT. And this is somebody that would have a little extra training for people with disabilities. So I think that could be really important. Asking those questions if they have that experience, and there's a lot of different resources out there. The Parkinson's Foundation has training. The Power Association has training. Rocksteady Boxing, the Bryant Grant Foundation, the APDA. There's so many great resources for people to get training, and I think that is excellent for people with Parkinson's. So again, some great questions to ask personal training. Now on to my favorite. What about physical therapy? Why and how to find the best physical therapist to work with you in the home? So for physical therapy, I think most people know that PTs are movement experts that really work with you to improve quality of life. We do it through exercise. We do hands-on care. We do a lot of education. And for people with Parkinson's, we can think of it early on for prevention of problems, prevention of movement problems, posture problems, balance problems, but also, of course, when you're experiencing those problems already. And one of the biggest pieces that I want to talk about is how to find somebody specialized for you. So under the broad umbrella, if you consider this top part, physical therapy as your broad umbrella, and then we're going to go even more specialized. So I'm not sure if everybody realizes that physical therapists can specialize just like physicians. They can do a residency program. So, for example, my background is doing a neurologic residency program. And then what you'll see from that therapist is that they're residency trained, and then often they will sit for a board exam in neurology. So they become a board-certified neurologic clinical specialist. Now, beyond that, they can actually become a movement disorder specialist. And this is a very growing area, I should say, coming soon to the world of PT. In our practice in Los Angeles, we currently have the only fellowship program in this area, but there are 10 programs starting across the country to train therapists very specifically in movement disorders. So keep your eyes open for that. And again, you can look for these certifications. I had alluded to the LSVT, the big and loud training, and the power before. And then here's another really great resource for you. If you go to the abpts.org, they have a Find a Specialist search. So you can follow that link and look for a neurologic specialist in your area. So that's a really great resource for you. Some questions when you're going to find a PT. And you know what? A lot of PTs have great experience in Parkinson's without having that certification. So it's not necessary if you ask these questions, right? Do you work with people with Parkinson's? How often? What is your approach? Do you have that residency or fellowship training? I encourage people to ask about things that they love to do. Do you use yoga or Pilates or mindfulness? Are you using principles of neuroplasticity? And we'll talk about these in a moment. But do ask those specific questions because that might be a good personal match for you. What does a typical session look like? How long do you actually spend with the physical therapist? Just like asking the OTs, what is your experience with home evaluations and recommendations? So very similar questions that you can ask the PT as the OT. So why this team for you? Why have this team? And we talked about these big themes. So prevention, recovering and maintaining your optimal movement, and your life engagement. And again, I have these couple bubbles on the side. We're talking about OT, PT, home health, but I do think it's a much broader team. And then finally, when we start talking about the evidence, I'm going to highlight this neuroplasticity, but I really think this team and this team coming to you in the home sets you up for really positive brain changes. So we're going to dive a little bit. I promise not to go too crazy into the research here, but there is some nice evidence about therapy in the home or community-based, so this therapy coming to you. And the first is an exceptional study. It's a large study with occupational therapy. This was a multi-center trial out of the Parknet group in the Netherlands, which you may have heard of. They did 16 hours of therapy over 10 weeks. And this is exactly what OT is so good at. They had improvements in their self-perception of performance, in their meaningful daily activities, which is exactly what we're looking to do. They also had improved participation in their ADLs, and other daily activities. So OT coming to the home can be very beneficial for people with Parkinson's in this study. Now, in the second study, this is out of the Parkinson Center of Oregon, they had people randomized to 3 groups. So either they had a home exercise program, and I think a lot of people have had this in physical therapy. They get the program and they go home and do it. So they had people who did that, they had physical therapy, or they had group classes. And what they found is that people who just had the home exercise program really didn't make the nice improvements in function and balance that the other groups did. So the take home from there is that it can't just be a home exercise program. And that kind of goes along with this next study with the DVD-based home training. In this, they found some improvements when the group who followed DVD instructions for their home program. So maybe better than just a written home program, but the in-person physical therapy was better for balance. And I think this is a really nice study. And, you know, we use video all of the time. We have people ask us, can we just do the video? And you know what? It does have some improvements. And you can do that at home very easily. But better to have home-based and individualized care. And I'm going to jump for a second to this last bullet point, the combo approach, because I think this is a nice follow-up on the DVD. In this study, they actually did a combination, and this was treadmill training. It wasn't a DVD, but they did in-home sessions, and then they did some sessions that they completed on their own. First was they found that it was safe because people can be very nervous getting on treadmill on their own. They also found that people improve their quality of life and their fatigue. But what I like about this is this combination approach, is that, you know, it might not just be that somebody can always be there coming into the home. Maybe you also have a DVD that you can follow in between, instructions to follow in between. What we do know, so just jumping back up to the prior bullet, is that we do need a high dose. So this Meg Morris and her wonderful group in Australia did a study looking at home PT 6 weeks for 1 time a week, and they were particularly looking to see if it reduced falls, and it did not. And so their conclusion was that, you know, we probably need more. 1 time a week for 6 weeks isn't enough. And I think this can be a big challenge, and why the combination approach is probably where we're really going to see the most benefit for people. So I'm going to show a video in the next slide, and a little disclaimer, this is a video that my colleagues and I put together for a video contest, actually, about therapy in Parkinson's. And so you'll see something about the Neuro Collaborative and my other colleagues and friends. I find this video very inspirational, especially because it's in her home environment. You see her in the home and in the community, and that is primarily where her exercise and therapy has been. And just seeing the benefits, it's truly very, very inspiring. So I'm going to share this video with you.
Who would have thought somebody at 70 years old with a neurodegenerative disease that's incurable is getting better all the time?
Hi, my name is Julie Hirschberg.
I'm Sarah King.
My name is Erin Caudill.
And I'm Claire McLean. Together, we are the Neuro Collaborative.
Hi, my name is Terry, and I was diagnosed with Parkinson's when I was 62, 8 years ago. When I was diagnosed with Parkinson's, it was a huge shock. I didn't know anybody that had Parkinson's. I just thought that what was going to happen to me after these 3 years of deterioration, I just saw blackness after that. I just thought my life would end. At the time, I was told to do everything I wanted to do in the next 3 years, because after that I wouldn't be able to. I should travel and do everything. For a while, I didn't do anything. I didn't really understand about physical therapy. I didn't understand how it could help me. I didn't understand that actually my insurance probably covered it 100%. I didn't know that I was entitled to it. I didn't know any of that stuff. I couldn't put on my Levi's. I had to lift my leg up to put it in one side of my pants. And to get in and out of the car, I also had to lift that right leg up to get it in and out of the car. So I knew there was something that was wrong. I decided to go to physical therapy because I was shuffling my feet, and I got a fracture in my left foot, and I got a lot of pain from arthritis, and I was grumpy and grouchy all the time and it didn't feel good. So I said, I've got to go to physical therapy for this foot so I can feel better and be happier. So that's, my foot got me going to physical therapy to learn how to walk better. I started physical therapy about 3 years ago, and that got me into exercising, and I've been adding more and more exercising classes onto that. When I'm walking consistently, like 7,000 steps a day, my mood is better, my sleep is better, my appetite is better, my digestion is better. I'm just a happier person, and it's the secret magic bullet that everybody's looking for, because it makes everything in my life better. The exercise classes that I'm doing have given me a lot of energy besides helping me feel better. I have the energy, and I also have the desire to interact with people. Now I'm in 2 book clubs, I'm cooking food, I'm working in the garden, trimming the plants, I'm going to LA to the theater and seeing my son. My life has really blossomed. I feel like I've actually been reborn and I'm coming alive again. Yes, with doing more exercise, I'm actually in better shape than I was in high school. The real secret in all of this is that I cannot do this by myself. If I didn't have a physical therapist who understands Parkinson's and knows how to set the bar higher while encouraging us is extremely important. I wouldn't be where I am right now without my physical therapist. And I'm looking forward to getting better and better and better. I'm going to live to be at least 90.
Isn't that just a great video? In the end, you see her with Claire McLean. She is a phenomenal Parkinson-specific physical therapist, but there they are walking outside in her neighborhood. And she actually mentions many of these principles that we know from the literature in Parkinson's that we can apply at home. Now, I'm not going to go into detail in these, but I wanted to talk about how we apply these principles at home. And this figure here on the right shows the basic principles of neuroplasticity in Parkinson's, and in particular that we know that we can change the brain through the exercise that we do. And so we'll talk about these particular exercises for the home just briefly here. So in the first one, we're talking about goal-directed motor skill learning, and I'll show a couple videos here. But essentially, this is probably one of the reasons why just following a DVD is not quite enough, because we need to learn through some feedback, challenge beyond our current skill, and facilitate engagement of movement awareness in a progressive way and possibly in changing environments. So early Parkinson's being in many environments, and later Parkinson's training in our home environment specifically. And we know that it changes the brain. So there's a lot of scientific language in those two statements, I'll tell you. But what we know is through the goal-directed motor skill learning that particular changes do take place in the brain. And I have a couple of videos here of a client in his backyard. So he was having some freezing episodes in the backyard. Family barbecues were really difficult. So here we were. This is very task specific, but we had some seasoning, unscrewing and screwing the seasoning, because that was something he was putting on the barbecue, and doing that while walking across the grass and around obstacles and things like this. So this would be an example of goal directed skill training in the home. And in this next video, Bed Bath & Beyond. I mean, who doesn't get overwhelmed there? I do all the time, but you can see there.
So that was more difficult as it got more narrow, huh?
We were looking for particular objects. This would be an example of therapy coming to you in the home and decreasing those episodes of freezing. The aerobic and cadence exercise principles can also be applied in the home. You don't have to have a tandem bike like the cycling studies. You can use a recumbent bike, a treadmill, even other movements to get high-intensity interval training, exercising at an intense level, so 60 to 80% of your heart rate reserve, and that's using the Carbonin method to calculate that. If you're on a bike, getting to 80 to 90 RPM, so pretty fast there, but that's what the research shows us. And working 3 times a week for 45 minutes at a minimum. But I know we're not all there. You got to start somewhere, and starting with 5 is totally fine, and start working your way up to 45. Next is the goal setting and self-management, and this is an excellent skill of the OT, and I see many PTs who've been specially trained in this. But in the home setting, identifying barriers and facilitators to your exercise and coming up with strategies to meet your goals, helping you find those exercises that you love, because that is the number one thing with keeping able to do it. Considering things that might be in your community or nearby, like group classes, and scheduling intense bouts with regular follow-ups has been found to be beneficial. And one of the biggest questions is, how much do you need? And so we know these are high numbers. And again, you can start small, but the research does show us that we need quite a bit of aerobic exercise, strengthening, stretching, and balance. It takes a lot of this practice and feedback to really change your brain. So if you're setting up a program within the home, these would be the guidelines that I would recommend for each of those types of activities. And finally, in our last couple of slides here, these are some questions to ask yourself about your home practice to know if you're getting that intensity and type of practice that is known to help make these changes. Are you acquiring a skill? Is it challenging and you're working hard? Is someone analyzing how you perform and providing feedback? Are you becoming aware of your movements? Are you continually being progressed? Are you doing the same thing over and over again? Are you sweating? Some people don't like to sweat, but this is part of the intensity. Is your heart rate getting up? How do you measure that heart rate? Having a way to do that at home. Is it fun? Maybe this is the most important question. Is it fun? Will it become a lifelong habit for you? Are you changing your environments, even in the home, or are you always doing it in the same place? Are you motivated to take your own control of the exercise and do it on your own? Questions to ask yourself when you are having care come to you and implementing it within the home. And then finally, I want to leave off with an example of collaborating with people in the home. This is with a fitness partner, so this is with a personal trainer, but you might consider this with your home health aide or with a caregiver as well. So we might set together goals to improve your speed or your balance, or set up a program at home. And so we do an evaluation. And so if you follow along on the timeline here, do an evaluation. We might work together for quite a while. And then you might start with a personal trainer, because one of your goals was to have a fitness program. And so I'll talk with them. We'll get you started on a program. They're going to give you accountability for that program. And then we start to taper our physical therapy, and you keep going on and working out with your trainer or your caregiver. But then you might have a change in your status. Maybe it's a fall or a hospitalization, or you got sick. Then we might come back in. Okay, let's reassess. Let's set up a new program and get you on your way. We might talk to your trainer or work with your caregiver again and get you started. And then you might again be independent with them, working with them. So this is just one example of many ways that a team would work together to provide and bring care to you in the home. I've included lots of references in little type if you want to dive into some of the research there, but I want to thank you so much, really, truly, from the bottom of my heart. I get so passionate about this that I probably went a little over our time, but I'm going to stay on for a while and stay on later to take questions, because I'd really love to hear from you.
That was fantastic. Really appreciate your presentation. Your enthusiasm is evident. As you said, this is something you really are passionate about, and I think it really shows through. So thank you very much, Dr. Hirschberger. So, number of questions that have come through, and I want to touch them on in just a second, but just a couple things I want to mention as part of housekeeping. We should have our resources slide coming up on the screen, and so those people who have questions, we have resources available on our website. Dr. Hirschberg mentioned some previous expert briefings that are available for download for those who are interested and just want to touch on them. They dive a little deeper on specific topics like occupational therapy and things. And so, we've got our helpline, 1-800-4PD-INFO, and we have my colleagues are standing by to answer questions that could come by. And we'll also shortly have a online survey appear on the screen. Really encourage everyone to fill that out. This is really important for us to provide feedback, not only internally for the foundation, but for our speaker as well, so that she can understand where things have gone well and things that can always improve upon as we always can. And if you weren't able to take notes all the way through this, fear not. We have an archive of the events. Our expert briefing today will be made available next week, June 18th, and you can find that at parkinson.org. And so this is, as I mentioned, going to be the last of our 10th series, and we'll have a little hiatus, and we'll start again in September. That's September 17th, 2019, and we'll be talking about communication strategies for optimal success. And so we'll have a presentation then. So let's dive into some questions that have come in. And there have been a lot that have come in, Dr. Hirschberg. And one of them is, just some basic ones. Where do we find these resources? You mentioned, some websites for Medicare. Are there websites to find these things in your own community, or is it something that you can ask your physician about? I mean, how do you find some of these people just to start the ball rolling?
Yeah, that is a great question. And, I mentioned one particular resource for physical therapy where you can find a specialist. So that link is in the slide. And I would say, if you are a part of the Parkinson Foundation and many of your local community chapters, for example, in Los Angeles, they actually keep a list of specialists in the area. And so I would imagine in most communities that you would find similar things through the local chapters because they've really networked and asked people the tough questions already and are really able to share that information. So that's where I first found it when I started working in this area. The other thing I would say is the movement disorder neurologists, they've been excellent with compiling resources as well for people. So I think that's a great place to start.
Okay, perfect. And, following up on that, a lot of people here have Parkinson's who are listening, but there's some people who have Parkinsonian symptoms like, progressive supranuclear palsy or multiple system atrophy, PSP and MSA. Are these people able to take advantage of these resources too? Are these, I guess, these aren't just for Parkinson's disease, are they? They're for neurogenic diseases along those lines, would you say?
Yes, absolutely. So a large part of my own practice is the Parkinsonian syndromes because we're so specialized that we tend to see a lot of that. And so the resources, absolutely. And I would say really that all of the care coming to you and the literature in Parkinson's really applies to the Parkinsonian syndromes as well. And we take a similar approach. We respond to people individually where they are in their disease process, and we may just have to have some other considerations of some of the other complications and factors as well. But I would say all of these resources, absolutely, and probably even more because I think with some of the Parkinsonian syndromes, you may have more of a need for care coming to you. And so I think we find that even more. That's a great question.
Oh, that's good to know that there's a lot of overlap here, and so you can hopefully find the same resources because I know that there's a much smaller community, but it's still in great need. Questions come through. I've seen this is from someone from Indiana who's got a family member with Parkinson's disease, and just in general, is there an age limit for when people can benefit from this? This is someone who has a relative in their 80s in the later stages of PD. I mean, is there a cutoff, and who can't benefit from this? It seems from your talk that you can't go wrong by engaging with some of these specialists.
Right. No, you absolutely can't. I'm like sitting here just smiling because that kind of question lights me up because, I'm working with somebody who is 97 at the moment and going really strong. The gentleman in the video who I worked with in the home, he was in his late 70s at the time, but, any age, exercise has no discrimination. In fact, some of the studies really have shown, not necessarily in Parkinson's, but in the elderly population in general, that strengthening, balance, aerobic exercise, some of the greatest benefits are coming for the people who are the oldest. So I think that's a really excellent question. And again, all of the research applies there. Now, if you look at some of the studies, a lot of the studies that are done, and I think this is a tough part of research, are in the more mild to moderate Parkinson's. As I went through the research looking at the care coming to you in the home, they tend to be in those levels, and I think that's a really big downfall of some of the studies, and it's where we are at in research at the moment. But from clinical experience for myself is that those things can very much generalize to many stages of Parkinson's, and that includes many ages.
So that, you bring up a really good question. We talked about different stages and dealing with people as they progress with their disease. One of the things I think about that can happen at many of the stages is this issue with fatigue and lack of motivation. This is a question from a spouse in Georgia and another family member from New Jersey, and they seem to have a general issue. How do you get someone who certainly may need these services, get them willing to accept it or even motivated to do it when they show up? Is it a losing battle, or is the person, the specialist, they can come, and you've talked about providing motivation, can they do that? What would you recommend in dealing with those situations?
Yeah. Oh my gosh, I feel like that was like one of my patients asking that question, or one of the caregivers. That is so hard, and it's so common, and I think as a care person, as a spouse, it becomes very difficult to be that motivator. And especially when we look at, later on, and if the apathy and the decreased self-motivation is so hard, it's a huge, huge challenge. And this is what I would say takes a highly skilled therapist. And you know what? I've also seen some highly skilled personal trainers to get in and get underneath some of those things and really not give up. I have had people that, they would just never get on a bike. They never get on a treadmill. In fact, they've told me their whole lives they've never exercised. And so we might start with those things, and they're just like, no, it's not me, and I'm never coming back. And I go, give me another chance. We got something else. It's having that creative person with you to find that thing. You know what? People want to have fun, and they want to be connected to other people. And it might not be a class. It might not be a bike. It might not be a balloon game. A lot of people like balloons, but it might not be a balloon game. But it's continually trying to discover that thing that lights them up. And this is where I think a very skilled OT, PT will just keep persisting to discover that thing, even for that tried and true, never exercised in my life and never will person. It does not need to be called exercise. It's just fun, and we're moving, and it is possible. So what I would say is don't give up, but you might need to keep searching for somebody with that level of skill? And that's a great question to ask people, right? Is what do you do when the person doesn't want to exercise? And, if they tell you, well, we discharge them, well, that is not your provider, okay? That is not the person for you.
That's right.
And I've seen it. It doesn't work for everybody. Not everybody's skilled at that. But I think that it brings up such a great question to ask people.
Yeah, thank you for answering. That's a great answer for that. And, it also leads me to think about some of the practical aspects we've talked about. You brought up about bringing care to the home. And, I was thinking about the home health aides that you talked about. There's a woman with Parkinson's who has to wake up in the middle of the night, who wakes up in the middle of the night yet needs help, for probably going to the bathroom or something like that, and has to wake up her husband, and it's causing a lot of friction. There's a woman from New Hampshire. Can the home health aides help with that, overnight? I mean, what kind of overnight care can people get for this? Because it seems how you defined a home health aide, with some of these activities of daily living that people are having trouble with, that they would be able to take advantage of that.
Right. That is an excellent question. I'm going to be totally honest that I don't know for sure the answer on that. But I'll tell you what I know for home health aides is part of it is this need for intermittent care. And so if getting up in the middle of the night to go to the bathroom is an ongoing issue, which it is for many people for their life, it may not fit in what is needed. Like a perfect example is I recently had a client who had a fall and had a hip replacement, and they needed help with dressing for a short period of time because they couldn't move in certain ways. And so Medicare covered 2 hours a day of bathing and dressing for a week until they could do the movement. That was the kind of thing that was covered by Medicare. I would say this type of thing is likely not, but that would be a great question for a case manager or social worker involved in that person's care. But I do think that is an excellent thing for somebody to come to the home and assess. So like an OT or PT, look at what is going on, from bed to the bathroom. Is there equipment that might make this better? What about a bedside commode? What about a urinal? There are lots of other pieces where having care come to you and assess the situation may actually make your need for that non-existent. I also have many clients too that have a caregiver for just that reason, because the middle of the night stuff becomes very dangerous.
Yeah, absolutely. We're really worried about falls, especially if they're alone and or with a spouse who's maybe have similar mobility issues on top of that.
Right.
One of the things you mentioned for again with home health aides, just thinking about that, what they could and couldn't do. You mentioned bathing, dressing. What about for transportation? I assume, again, since we were talking about intermittent use, they wouldn't be able to help with that. Take someone to the doctor. That would be you would hire someone privately, I guess, in order to do that. You wouldn't expect insurance coverage. What's your? I appreciate you're not an expert in this, but what's your understanding? Of how that might work?
That is also my understanding, is that it wouldn't be used for transportation. In general, part of the definition for Medicare for home health aid is homebound. So that means they're not really even leaving the house. So I think by that alone, the transportation would not be a part of that. And I will say there's a lot of great resources in the community, and it's very, very local specific, that may provide transportation for people. There's things like access, for example. So I think if transportation is the question, typically people are hiring that privately, but I would also look into your community for free or very low-cost transportation resources for people.
Okay, that's perfect. I just want to ask a very specific question about one of your slides, you mentioned about aerobic exercise and getting the heart rate up to 60 to 80% based upon the Carbonin method, I think is what you said. What is that? I mean, I know some other rules of thumb about, like, 160 minus your age or something like that, and you go from there. Is that what we're talking about, or is this a more complex way to calculate what your heart rate should be?
Yeah, that is a great question, and I actually went back and forth for actually putting the whole thing in there. The Carbonin method is particularly what has been used in research studies, but you are right with a very simple 220 minus your age is a rough estimate of your max heart rate, and then you would exercise at 60 to 80% of your max heart rate. That would be the simple way to do it. Carbonin method, if anybody Googled it, would give you a target heart rate and your heart rate reserve. And so it's a little more complicated. You take your max heart rate and you subtract a resting heart rate and you multiply that by the intensity and add your resting heart rate. So it's a few more steps of the mathematics, but that has been used in the research study. And there's little Carbonin heart rate calculators that you can use online for that. But I will always tell everybody, if you want to do a quick version, 220 minus your age, and that's your max heart rate, and then you train at a percentage of that max heart rate.
Okay, perfect. I've got a question. I know we're over time, and I thank you for your time. And just two more questions, if I may.
Yeah.
One is
for
from a
sure.
healthcare professional in Idaho, and this person's trying to understand what billing codes should they use for PT services that are outpatient in the home versus home health. Is there? I mean, that's a very technical question. I appreciate that, but I think it would be something well utilized if you happen to know that. If not, then we can dig deeper with you at another time.
Yeah. There's probably a long answer here, but I'll try to go short. So there are a couple of things first before you can actually bill for it. As a Medicare provider, when you apply, you actually, if you're a PT in Idaho, hello, by the way, you would actually apply and say that you are providing some services in the home. Your CPT codes, all the coding that you would do would be exactly the same as your outpatient billing, all the same codes, all of that. And in your documentation, you just note that it's in the home, but you do have to say in your Medicare application, when you apply to become a provider, you do have to say that you are going to provide some services, some outpatient services in the home. All the same codes apply. Now, I don't do home health billing. I'm not a home health agency. So if you are a home health agency, then you do billing according to the home health rules, which are different than outpatient rules. But if you are an outpatient provider and you want to go into people's homes, you just bill your outpatient codes, which is kind of simple and nice.
Okay, great. And so final question, and I think this would be a great one. Someone's come through from Florida just asking, after listening to your presentation, what should be the one person that they should contact? Should it be an occupational therapist? Should it be a physical therapist? Who would be the first person you would recommend, someone who's listened to your talk, to go out and reach out to in order to get some of this help?
Oh, you put me on the spot. It's really hard for me to not just yell out PT. In my experience, the PT has actually, in the movement disorders world, really been the hub of the team in the home. But I'm going to say PT with a caveat. We didn't talk about your movement disorder neurologist, but I really do think your movement disorder neurologist really becomes that that person, they may prescribe the care. Now, I live in a state where you can directly come to me without that prescription, but that's not everywhere. So the movement disorder neurologist is going to prescribe that care, and if you want it covered by Medicare and it's home health Medicare, it has to be prescribed very, very specifically by your neurologist. So that is probably your very first step to go, and then grab your really great PT, OT, home health, speech therapist, grab your whole team to join you on that journey.
Fantastic. I think we'll close with that. Dr. Julie Hirschberg from USC, When Care Comes to You. Thank you very much for your time, and I hope all our listeners have a very good summer, and I look forward to talking to everyone again in September. Bye-bye.
Thank you so much. Bye.